temporary leads are used in more than 350,000 procedures each year. Now, this is a number that's growing rapidly as the population ages and TAVR becomes increasingly common. So here we are, as you can see, at TCT 16 in Washington, D.C., and this meeting features a collection of work under the heading Interventional Innovation and Best Technological Concepts. One of those presentations this year is focusing on the first-in-human experience with a novel active fixation temporary pacing lead, its safety and efficacy of the Tempo lead. So to talk about this, I'm with the co-principal investigators, Dr. Mark Webster, cardiologist at Auckland City Hospital in Auckland, New Zealand, and Sanjeevan Pasupati, who is an MD and cardiologist at Waikato Hospital in Hamilton, New Zealand. First off, thank you very much for your time, and I love the fact that this is new, and obviously it's in the great innovation section. Tell me a little about the technology.
Well, it's a new pacemaker lead. The pacing technology hasn't really changed in 20 or 30 years. It's an area that hasn't had a lot of resource put in, and so this is a device with some novel features that overcome the limitations of previous generation pacemakers. So it's got a very soft distal tip, and it's got two deployable stabilizers that can be released and can engage the myocardium to keep contact with the myocardial wall and thereby lessen the risk of loss of pace capture.
Now, what are the situations where something like this would be used?
So commonly, the two main complications of when we put a temporary lead is you get perforation and you get tamponade from that, right. Or you can get, like Mark said, loss of capture, so the lead dislodges itself and then you can get a loss of capture. So this particular lead addresses both of those things and mitigates it, and that's the whole point of the study, to see if we are managing to achieve that with this lead.
So in this particular case, how many patients were you looking at, and what did you present here?
It's a small series from two centres. The patient mix was a combination of patients having structural procedures, mostly TAVR, and also electrophysiology procedures such as ablations where a temporary pacemaker lead was needed. But I think the population in whom this device might be used extends well beyond that. So in the clinical setting, patients who come in with high-grade heart block and potentially need a permanent pacemaker, this would be a very good temporary option. And then there are other procedures like alcohol ablation for hypertrophic cardiomyopathy, again, where the conduction system can be affected and a temporary pacemaker lead may be needed for 2, 3 or 4 days. So I think there are a lot of clinical or potential clinical applications here.
What are the challenges in placing this? Is it pretty easy? Is it well designed for the investigator who's putting it in?
So yeah, the lead is very trackable. It's fairly intuitive. It needs to be shaped so that the shaping part, obviously, it's not a challenge, but it's something that we do to get the lead into the right place. And then once it's in the right place, the lead has a lot of good functions that actually helps you to get there. So it's got a balloon that may direct you towards the right area. There's a soft tip that makes it very confident to place the lead in the right place in a safe way, because the most important thing is to make sure any device that goes in is safe for the patient. So it provides those two and gives that confidence when you deliver the lead that you're able to achieve that. And once you're in there, then there are features to be able to deliver the two stabilizers, and that is very easy. So as we can see, I think we were both tested every time we put the lead, but we thought about delivering the stabilizers and also then releasing the stabilizers at the end. And they are a piece of cake. They're very easy to deliver and they're very easy to remove again as well.
Now, this is an area that's not being particularly well served. So are you guys getting phone calls and emails saying, hey, what can we do about getting involved in this? Because it sounds like an exciting technology.
Well, I think that's just starting to happen now, actually, with the presentation. So I think that will continue to increase. So, yeah.
So what's next?
I guess distributing and getting it into physicians' hands. So that's obviously a process in itself, and these technologies need to be rolled out, and there's got to be some training involved as well. So that needs to occur.
Right. And as you know, the lead has got an FDA approval, exactly. So it can be sold. It can be sold in US, and there are lots of other parts of the world that will accept an FDA approval for the lead to be distributed. And then there are other parts of the world they may need other regulatory needs, may not need a study, just the regulatory needs to be filled. Once it's there, the distribution will be much better and it will grow.
So are you excited about it?
Very excited about it.
You think the good technology is going to be around for a while, and that this it's filling a place that has been needed to be filled?
I think so, and with the TAVR procedures in particular are growing very rapidly. So the the range of indications are widening, and the number of patients who might benefit are increasing quite quickly. So yeah.
I thank you very much for your time, because this is great technology, and it's part of our meeting coverage here at TCT 16. Please check online and in both books, CardioSource World News and CardioSource World News Interventions, where I'm Executive Editor Rick McGuire.